Sight words presented by Janelle, Kelly, Rachel, and Monica.
Sight words are high-frequency words a reader automatically recognizes. Sight word instruction is the most common form of reading instruction, both for neurotypically developing children as well as those with disabilities. They constitute a large portion of what a person encounters in their texts. They are also dependent on memory, so words should be functional because they are used so often. Historically, reading instruction for students with significant cognitive disabilities has been underemphasized, and there's been a consistent lack of focus on reading. Students with significant cognitive disabilities do require intensive instruction in order to learn to read. The No Child Left Behind Act requires schools to evidence adequate yearly progress in reading, as well as math and science, for all students, including those with disabilities. There are guidelines that they need to follow. The Individuals with Disabilities Education Act of 1997 requires that all students with disabilities participate in state assessments and have access to the general education curriculum. So why should we teach sight words? Well, recognizing words plays a crucial role in reading texts. Sight word reading is a stepping stone to reading and comprehension. This ability supports communication, both reading and verbal communication. Without word recognition, gaps do expand between good and poor readers as they progress academically, which do become more profound the further they progress in their academic career. Instruction can increase comprehension, fluency, and confidence, which in turn decreases the frustrations that come along with learning to read. Teaching sight words is a traditional, predominant approach for those with cognitive disabilities, and its ultimate goal is to develop the ability to independently read connected texts, such as sentences, books, etc. So, past research has shown that pictures should actually not be used because they may produce a blocking or an interference effect while you're teaching sight words. An iPad can actually be an effective device for teaching sight words. However, they can be costly, and the list can't always be customized to each student depending on whichever app you may use. On the other hand, using flashcards has been found to be effective and is enjoyable to both the teacher and the student. Also, immediate feedback has been found to be more effective than delayed feedback when teaching sight words. So again, enhancing students' abilities to automatically read these commonly used words, these functional words, may improve students' comprehension and confidence. These rates of correct responding were enhanced as well if the children repeated the word after they had heard it using this immediate feedback approach. So this brings us to simultaneous prompting. This is a strategy where an instructional cue is shown simultaneously with a controlling prompt. This is also known as, more commonly as a 0-second prompt. The student immediately responds or repeats the word after the teacher has imitated it. This may eliminate potential problems with time delay. Sullivan found in their study that modeling this corrective feedback and the practice of it contributed to success. Simultaneous prompting has also been effective in teaching a variety of skills other than reading, like matching, pretend play, responses, and identifying relatives by their names in pictures. So, direct instruction. This is highly effective for isolated sight word knowledge. It uses flashcards to teach things like words, math skills, that kind of thing. It's used to teach discrete skills such as those, and it encompasses an error correction procedure like simultaneous prompting, as we previously mentioned. It's easy to individualize or to modify based on the student's skills or where they stand. It is research-based, and it's also practical and efficient. Materials are cheap, it's very timely, it doesn't take a lot of time to do it, and it does seem to be enjoyable for both the teacher and the student.
And now we will move on to our methods section. Our study contained 3 participants diagnosed with autism spectrum disorder. They were selected from a public elementary school and a designated program for children with ASD. Each of the participants struggled with adequately obtaining the skill of reading sight words. Bobby is a 5-year-old African American male diagnosed with moderate autism spectrum disorder. Bobby has a reported IQ of 67. John is a 7-year-old Caucasian male diagnosed with mild autism spectrum disorder. John has a reported IQ of 70. Kate is a 6-year-old Caucasian female diagnosed with Asperger's syndrome. Kate has a reported IQ of 77. All sessions were conducted during school hours in a self-sustained special education classroom. The participants attended the school Monday through Friday from 8:30 a.m. to 2:45 p.m. Sessions took place in late morning between 10 a.m. and 11 a.m. Each session was conducted in the classroom in a one-on-one setting between the participant and the experimenter. The materials used were pre-made word cards and the paper for the researcher to record data. Here are some examples of the sight words that were used with all three of the participants: the, of, to, and, a, in, is, it, you, that, they, at, very, etc. The intervention consisted of the use of word cards to present the sight words. Each child was given the same word card to work with. A changing criterion design was used to demonstrate a functional relation between learning a group of sight words and comprehension of those words with prompting. There was a baseline phase of 20 sight words as well as 4 phases which also consisted of 20 sight words. The dependent variable is the number of sight words read correctly. The independent variable is the use of word cards with direct instruction. During the baseline phase, all of the participants were assessed on their ability to read the words on the word cards. We would offer one prompt to the student to encourage their reading of the word, such as, "What word is this?" We would then wait 3 seconds for the student to respond, and then record their response. We provided the student with a verbal praise, such as "good job," but it was not to be in accordance with accuracy. Baseline phase lasted for the first 5 recorded sessions. The phases were conducted in a one-to-one format with the student and one of the experimenters. The students went in no particular order during the sessions. The word cards were presented to the students along with the prompt, "What word is this?" If the word card was read correctly, we provided verbal praise, "Good job." If the student incorrectly read the word card, we provided corrective feedback paired with a second opportunity to respond. "No, this word is blank." "What word is this?" The researcher recorded correct and incorrect responses during the sessions. Once the student reached 100% correct of the sight words, the students transitioned to the next phase of instruction, introducing the next 20 sight words. This continued until all phases were complete. Kate had previous exposure to sight words through video modeling. Due to this, Kate was able to acquire the sight words at a quicker pace than the other participants. Kate completed her 100 sight words within the first 20 sessions. John was able to meet the expectation of 100 sight words at 20-word increments. John met the criterion of 100% of sight words read accurately in the 25 sessions. And during the first few sessions with Bobby, it was clear that this was a difficult task for him. We lowered his criterion to 10 words per phase. Bobby was able to meet the criterion of 50 sight words in 30 sessions.
The results of the current study extend previous studies by extending the findings of utilizing a direct instruction flashcard method to teach sight words to students with disabilities. With respect to baseline data for each participant, the results suggest that implementing a direct instruction flashcard method led to an increase in the number of sight words read correctly by each participant. Baseline results show that before an intervention was introduced, John read 0 words correctly, Bobby read 0 words correctly, and Kate read 20 words correctly prior to the intervention being introduced. Several subphases were presented during the intervention phase, and the subphases differed in criterion for performance for each participant. Each participant demonstrated stabilization in levels of responding during each subphase, and criterion levels were subsequently increased. For John, he began the first subphase reading 15 sight words correctly, and by the end of the first subphase, he was reading 20 sight words with 100% accuracy. As you can see depicted in Figure 1, criterion levels were increased by 20 sight words in the subsequent subphases until John was reading 100 words by the end of the 30th session. Bobby began reading 9 sight words correctly during the first subphase and read 10 sight words correctly by the end of the 10th session in the first subphase. As old levels of responding stabilized across the subphases, criterion levels were increased by 10 sight words read correctly by Bobby. By the end of the very last session of intervention, Bobby was able to read 50 sight words with 100% accuracy. Lastly, Kate began reading 40 sight words during the first subphase. Levels of responding rapidly stabilized across the subphases, and levels of criterion increased respectively. In just 25 sessions of intervention, Kate was reading 100 sight words with 100% accuracy.
Now on to our discussion. Our study does suggest that using a direct instruction flashcard method to teach sight words to students with disabilities was effective. It led to an increased number of sight words read correctly by John, Bobby, and Kate. Children with autism have a difficult time communicating basic wants and needs. Having them learn how to read a variety of sight words can be the first step to improving their vocabulary and comprehension skills. This is crucial because it could decrease the struggles that come along with the challenge of not being able to communicate appropriately and effectively. These struggles often include episodes of aggression and problem behaviors that emerge when our students are not receiving proper instruction. From our results, one can see that the use of immediate corrective feedback played a key role in the improvement of all 3 participants as shown in the study by Waugh, Alberto, and Frederick. Furthermore, the decision to not use pictures while teaching the words, like in the study Fawcett and Miranda, could also be a contributing factor to the success of our study. There were 2 potential threats to internal validity. The first would be echoic noise in the room that could have been distracting during the sessions, which in turn would make it harder for the student to respond within the 3 seconds allotted. Children with autism take a longer time to process information, and 3 seconds might not be enough time for some students. Another threat would be how the student was feeling during the session. Because they have a hard time communicating, teachers might not know that they don't feel well and just chalk it up to them being non-compliant. Limitations include teacher attention that was used as a reinforcer. This could in fact worsen the student's growth for independence over time. Another limitation is that the student could become prompt dependent when reading. Extra time and effort would then be necessary to break the prompt dependence cycle. There were 5 meaningful ways that future research might enhance the external validity of our study. Generalizing across different contexts and settings, etc. This would be very beneficial for our students to be able to read outside the classroom, like with their parents in the community. Another is testing for comprehension. Post-test probes for longevity, teaching connected texts to words, and teaching pre-reading skills such as turning pages in a book and reading from left to right.
Thank you for listening to our study. We hope you enjoyed it.